那今天我们的活动就正式开始。首先，我们要邀请我们中华民国老人福祉协会的韩春菊理事长跟我们说说话，欢迎韩姐。
各位辅助科技领域的先进伙伴们，各位贵宾大家午安，大家好，大家好。我们时常看到许多老人家坐轮椅，坐得歪歪斜斜的，或者驼背，或者身体一直往下滑。那长时间不正常的坐姿呢，将对健康会产生很多的影响。那比方说呼吸不顺啊，吞咽困难啊，压伤啊，身体变形等等。那在这个恶性循环下呢，都将会严重影响到生活的品质。照顾工作呢，也会变得更加的困难。国内针对儿童还有年轻身障者的坐姿摆位与移行的服务和探讨很多，可是相较之下呢，针对高龄者的这个部分呢，就非常的缺乏。那 WHO 的研究也指出呢，高龄者获得辅助科技的机会跟年轻族群相比，就明显差很多。这其实也是一种偏见跟不平等，所以因此让我们兴起想来办理今天这场的研习会今天很开心再次邀请到我们国际医材集团 Permobil 的亚太区临床服务总监 Rachel Fabiniak 物理治疗临床博士来跟大家分享。我想先打岔一下，我们要报告一下 Rachel 呢，她最近刚怀孕4个月，她这次是亚洲就是最成功的旅行哦，她这次是怀孕以来第一次成功的旅行所以我们想给 Rachel 给她一个热烈的掌声跟掌声鼓励跟祝福。OK， 好，那接下来呢，再继续想，Rachel 跟那个 Permobil 的团队每年都会参加在美国或者加拿大，他们会轮流举办国际坐姿摆位研讨会，简称 ISS 的这个发表。那个 ISS 是全球最大、最专业的坐姿摆位展览跟研讨活动，所以大家都非常的幸福。我被告知说去参加这种的费用都相当的高。因此，真的在座的都非常的幸福。我们在台湾就可以听到这么专业、具有科学实证的分享。好，我们都很有福气。好，那我还要特别感谢中山医学大学附设医院辅具中心的施启明组长、施老师。那除了施老师是我的我们就是具有革命感情的伙伴20多年来就跟着老人福祉协会一直在做努力推广正确的辅具的正确使用OK， 但施老师呢，除了担任今天中的座谈主持人以外呢，在议题的设计上也给了我们很多的建议跟指导。当然也要谢谢协办单位雃博公司的全力协助动员了很多的同仁到现场帮忙，谢谢崔副总OK， 好，谢谢。我最后呢，再次代表主办单位老人福祉协会，欢迎大家，预祝今天的活动圆满顺利希望对各位的工作有帮助祝大家健康平安谢谢大家。
谢谢韩姐。那韩姐请留步，我们准备了一个小礼物要送给 Rachel， 那请 Rachel 到前面来，然后韩姐帮我们制赠这个小礼物。
去年送了一个礼物，是刚好跟 Rachel 有同一个生肖的，这是意外的惊喜。今年我们也是特别挑，秘书长特别挑了一个礼物。
解套中间，你们，韩姐，我们到那个立牌那边好了，比较不会有光。好，那我们也现在也邀请这个施老师，然后 Rainy， 然后Owen 跟 Byron， 我们一起到前面合照好吗？对，大家先一起合照。那我们等一下也要邀请我们现场所有的来宾跟我们大家一起大合照，所以大家等一下如果方便的话，你们可以把口罩先拿下来，露出你最可爱、最灿烂的笑容，这样子。 上前也一起拍一张。好，谢谢老师们。那请大家先回座，我们来跟大家所有现场的来宾一起拍个大合照。对，好，我们今天就拍3个动作，一个是就是大家都坐好，然后呢笑眯眯就好了。好，这是第一个动作。对，方便的话，好，来 ，OK 了吗？好，好，再一张。好，第二个动作，我们今年来比这个脸颊爱心，我们不要再比手指爱心了哦，已经不流行了。脸颊爱心，好，好，那最后一个动作，我们大家给自己一个赞。好，那我们现在就把时间交给 Rachel 跟 Rainy。
Thank you everyone for coming today, and thank you for the wonderful introductions and the very special gift. So today, I'm probably going to try to stand for a lot of it, but excuse me if I have to sit down at all. So today we're going to be talking about understanding the aging population and the evidence-based approach to mobility and seating.
喂，好，那今天的主题大家应该都可以在荧幕上看到，主要还是跟高龄者相关。然后我们今天在每一张的，就是投影片都会做一些简单的翻译。我们这一次不会做逐字的翻译，就是为了能够让那个内容可以更多一些。那我会做每一张做一个简单的一个重点的介绍，这样子。好。
So we're going to start with the why. I always like to start every presentation understanding why it's important that we're all here today and why it's important that we're discussing this topic. And this is the why. This is just one image of an elderly person in a wheelchair. This is taken from the US, but most places around the world we would see similar setups. People slouched in their chair, in a chair that doesn't fit them properly. Maybe a chair that came out of a closet and was just given to them. In many countries, there's no funding for people once they hit 60 or 65. So this is our why. Why is this acceptable? Better? Okay. I can switch to handheld if I need to. It's okay. Why, when we're talking about this person, why do we allow this globally? And we have to educate more so that this doesn't keep happening.
这是我们常见到长者坐在轮椅上的状态，而且这不是只有台湾的状况，其实现在在全球都有这样子，就是这样子的一个国际上的一个议题，关于老人的一个坐姿的问题。那我们其实可以看到整个这个轮椅的配置都非常的有问题，就是轮椅可能有过宽啊、扶手过低啊、坐身不足啊等等。那我们今天希望的是，就是长者的轮椅，它不是就是在随便到一个置放轮椅的地方挑一张看起来可以用的一个轮椅，而是我们能够针对他们的需求去提供真正合适的辅具，然后不论年纪，他们都应该要跟年轻的用户拥有相同的一个机会。
So first, let's talk about some of the global data on aging. This is a quote by the World Health Organization, and I'm going to read it straight off the slide because I think it's very important. Assistive technology enables people to live healthy, productive, independent, and dignified lives, and to participate in education, work, and civic life. Assistive technology reduces the need for formal health and support services, long-term care, and the work of caregivers. Without assistive technology, people are often excluded, isolated, and locked into poverty, thereby increasing the impact of disease and disability on a person, their family, and their society.
那这边其实整段的文字我不做逐字的翻译，但主要就是在说明辅具的使用的一个重要性。那我们今天所分享的一些关于 AT 的理念，不仅仅是我们自己个人的想法，而是就是 WHO 国际上同时在倡议的一个理念。
The other thing we need to think about is that not everybody ages the same way. There are some people that are 80 years old that are more active than a 30-year-old. My grandpa turned 90 2 days ago, and he exercises every single day, which is better than me. And that's why we have to think about putting the person at the center, a patient or a client or a person-centered approach to healthcare. We can't box somebody in because of their age or their disability.
那这边的重点其实就在于说，其实没有典型的老人，没有典型的老化这件事情，然后不要因为年纪就觉得他们不行，然后也是要再次强调以个人为中心的一个评估方式。
Now let's look at some statistics. We are an aging global group. In 2019, here it is. In 2019, there were 703 million people aged over 65 years in the world. That number is projected to double in the next 30 years to 1.5 billion by 2050. Globally, we're already seeing that increase in people over the age of 65, increased from 6% in 1990 to 9% in 2019. And it's proposed to rise to 16%, or 1 in 6 people by 2050 will be over the age of 65.
总结其实就是说，年长者的一个数量其实是呈现一个爆炸式的一个增加。那我们其实需要就是这些老人他们能够保持健康，然后保持活动，远离医院。那这样才能够就是在未来我们其实是没有足够的人手能够去为年长者提供照护。那确保这个目标的方式，其实我们希望能够在早期尽量提供合适的一个辅具。
So what does the World Health Organization say? They came out with a report that talks about making sure we have the next decade of healthy aging. And one of the things that they emphasize is optimizing functional ability is a key to healthy aging.
那因为我们人的平均寿命增加嘛，我们期待就是能够促进这些老人是健康的老化，然后这个对于预防年长者的一些并发症跟社会福利的这个系统的一个压力，都是一个重要的课题。
We're going to keep coming back to that idea throughout the presentation.
Yeah.
There we go. So first, let's understand what happens with healthy aging. Healthy aging, there's normal changes in our body with healthy aging. We're going to have movement function changes, changes to sensory function, to our skin, to even to our immune system.
那其实这个所谓的老化阶段，人或多或少就是过了成长期之后，就会开始有年龄增长相关的变化发生嘛。那不管是在动作方面啊，还是在感官、认知啊等等，这些都会在随着我们的年纪有着老化的一个状况。
What happens to our movements as we age? Normal part of aging is that our muscle mass peaks in early adulthood, which means for many of you, it's already peaked.
其实对于我们人来说，其实我们可能都已经过了那个就是高峰期，大家都在走下坡的意思。就是不管是你的什么肌肉量啊，或是说我们各个身体的部分，都有在做这个逐步的退化。
Sensory-wise, we're going to see a decrease in vision and a decrease in hearing.
主要就是视力跟听力的方面，在感官的部分。
The skin is very important when we talk about wheelchairs and mobility and seating. The skin is going to have major changes over the aging period, which includes decreasing our collagen and elastin fibers, decreasing the blood flow, and because the skin actually gets thinner, we're decreasing our immunity or our barrier between the outside world and our body.
那皮肤其实主要就是像是胶原蛋白啊、弹性纤维啊都会减少，然后甚至像是血流的减少等等，这些都是老化的自然过程。那在长者身上，其实也会因此就更容易会有一些所谓压伤的问题。那皮肤其实作为人体的一个天然的屏障，就会随着我们老化，它的保护力会逐渐的下降。
Here is the normal aging process with skin, showing you how much thinner that skin is.
那其实皮肤会随着年纪的增加，然后厚度会变薄，然后里面的各种就是像是汗腺啊、弹性纤维等等的，都会让我们的它的数量会减少，然后使得皮肤更加的脆弱。
Now, what happens with that thinning skin, right? We have thinner layers. We have decreased blood flow. We have a loss of the viscoelasticity. We have less nerve, or our nerve endings become more dull, so less sensation, the ability to feel when we need to move, and thinner layers, which all leads to this big increase in pressure, changes in microclimate, the potential for shear, which increases our risk of pressure injuries greatly in our aging population.
在年长者这个族群之中，就是他们随着年纪一些血流的下降啊，脂肪层的变薄，然后神经末端的一些改变，然后皮肤上面的这些微环境，像是就是湿度啊、温度啊，然后这些的改变，其实这些都会增加我们所谓的压伤风险。
And what else happens? As we age, we can tend to have more comorbidities, right? Multi-morbidity, we call it. So we can have things that impact us that we can't help, like skin changes, right? Also very common in some parts of the world, diabetes, people having falls. And as we see these comorbidities add up, we also start to see what we call this problem with polypharmacy. Lots of different medications. And many of the medications actually interact with each other and cause more problems, often cases.
那这边主要就在说，年长者其实随着年纪，时常会出现这种叫做多发共病症，就是各种 不同的疾病其实同时发生的一个状况。那长期下来，其实也会导致所谓的多重或是重复用药的一个问题。
And then we have aging with a disability. So that's all just normal parts of aging. But what happens when we also have a disability and we're aging? It used to be that if you had a spinal cord injury, your lifespan was much shorter. But now, with great medicine, great therapeutic interventions, people are living much longer. Someone with a spinal cord injury may live to 85% of their typical lifespan. Same with many other neurological conditions. MS is included in that. So this is wonderful, but as we have this growing population, we also have more specialized needs.
那因为医疗科技的进步，其实导致整体人口的平均寿命增加。那其实就算是一个，举个例子，连 SCI 这样子的一个患者呢，其实基本上也都可以达到一般平均寿命85%。所以有专业医疗需求的人口其实是不断在增加的，这也是我们在这个医疗的部分需要去做考虑的部分。
For someone aging with a disability, they have the potential to have the effects of living with that disability plus aging, adding into this cumulative effect. We also see that they're going to have a higher incidence of having secondary complications as they age. So as they age, if someone's in a manual wheelchair, they're going to be more likely over time to have shoulder pain or a shoulder problem. A bigger chance too of chronic pain.
那这边在说的其实就是所谓失能的一个累积效应。一个原本就是轮椅使用者的人，他在他年轻的时候跟他已经到了年长的时候，他的需求可能就会不一样。那他可能之后可能随着时间，他是后续发生是因为推轮椅可能发生了像是肩关节疼痛等等的这样的一个问题。所以个案在失能的时候，可能有更高的所谓的继发型的健康问题的一个发生率。
And we're also going to see accelerated aging, which means that the rate and the effects of aging are going to happen even sooner.
那这边很简单，其实就是在说老化的问题，在失能的状况下，它其实会进行或是发生的更快。
So what does that mean for us? We have to plan ahead. Right? We have to think about this person and aging and living a much longer lifespan. Do you all know the ICF model from the World Health Organization? I put this model in every one of my presentations because it's so important for us to think about the future. When I first started working, I was working in a spinal cord injury hospital. So most of the people I saw had just had their spinal cord injury. Now, we started to see people that were maybe 2, 3, 5 years, maybe even 10 years after their injury. But it wasn't until I started working in the community that I saw people that had had their injury much longer. I saw a gentleman that had his spinal cord injury for 50 years, which was the longest time after a spinal cord injury I had ever seen someone. And I saw him not because of his spinal cord injury, but I saw him because he had infection in both of his shoulders. The doctor said it was because of the years of urinary tract infections and the overuse of antibiotics that made him susceptible to have this infection. And it attacked his shoulders because that's what he most commonly used. This gentleman propelled his manual wheelchair. And he said that when he was younger, he did everything. Floor transfers, had a big tall car. This was in the US, so they like really big cars there. And he would bring his wheelchair into the car with him. And he said no one really explained to him how he would feel 50 years down the road. And it made me think, am I planning ahead? Am I thinking when I see this person about preparing them for the next 50 years? If they already have a problem, am I considering that in my ICF model when I'm thinking about the type of equipment or how I'm training them?
好，这边就是 Rachel 举了一个就是 SCI 的例子，大家应该可以稍微理解，就是他前面讲说，我们其实大部分会在一开始遇到都是一些可能受伤没有多久，甚至可能5年、10年这样子的一个 CI， 但是其实我们真的很少遇到，就是说，看到一个 SCI 的患者，他50年后的一个状况。那他刚才所说的这一位case， 他其实就是。因为他长期有这个泌尿道感染的问题，所以其实一直有在使用就是抗生素这样的问题，所以呢，就是他的双侧肩关节发炎，就是因为这样就是用药啊，以及肩部的过度使用，所以他其实在年轻的时候就是什么都能做，但是后面我们就去想说，其实我们是不是能够在一刚开始的时候就去为他的这个未来去做一个规划跟一个预备，那其实能够去更加的在一刚开始的时候就用 ICF 的 model 去思考说，他在未来会需要什么，而我们现在可以为他做什么，让他去有更好的一个就是老化之后的一个身体状况。
This is better because I breathe too heavy now.
Yeah, I agree.
So what are the barriers for someone to get the right equipment when they're older? I'm guessing that this problem also happens in Taiwan, as it does in every other country that I've ever worked in or spent time in or even just visited and went into a hospital. So there are barriers for the aging population. One is there's actually very little research that's done on this population. And if it is done, it doesn't work globally. It's very localized to one country. So we don't get to learn from one another. A lot of times there's very limited programs or even in some cases where I worked in one long-term care center in the US, and there was only one of me and a whole group, a whole home of about 45 people that I was supposed to see and take care of, not only their equipment, but also physical therapy during a weekly basis. What about age-based discrimination? Many of us, without meaning to, are ageist. We think that once somebody turns a certain age, they're not capable of learning something new or pushing a manual wheelchair, or how about a power wheelchair? I once prescribed a power wheelchair for someone that was 88 years old and had never driven a car in their life. And the physical therapist that they had been seeing called me on the phone to tell me I was crazy. They did successfully drive that power wheelchair after some significant training. What about affordability. What kind of funding is available for people over 65? Many countries, like Australia, have wonderful funding from the time you're born until you're 65. And then there's a different funding system that's much worse. Who decided 65, right? We had a client that one of our team members presented on at ISS that just happened in Pittsburgh. And it was about an individual that had a stroke the day after he turned 65. So instead of getting all the wonderful funding, he got very little. How is that fair? And what about the life expectancy? This is what people always say to me. Well, you can't give someone that's older a good wheelchair because they might die sooner. Now, I just told you my grandpa turned 90 2 days ago. 65 was a long time ago. 25 years. Some of you are probably only 25 years old. How many wheelchairs could my grandpa have had in 25 years? Right? So we've got to take that out of the picture.
好，这边就是主要其实就在说明高龄族群他们使用辅具的一个障碍。那前面有讲到，就是其实现在国际上不管是不是就是台湾之内啦，其实国际上也是这样，就是缺乏一些针对性的研究，而且没有国际之间的比较，没有办法去比较各国的数据。那当然也会有就是像我们是处方者的心态、照顾者的心态等等一些刻板印象，其实会缺少让年长者使用辅具的一个意识。那当然，社会跟经济的一些决定因素也会影响到老人，然后高龄族群去使用这个辅具的一个流程。
So now we know that none of us in this room are ageist, and all of us in this room would get, if we can, the aging person the best wheelchair and seating possible. So now let's move on and start to talk about how we make sure we get the right products for them. We're going to start with posture. Now, there is a normal aging process with posture. And this changes over time as well. And it also depends on what the person did during their life. For all of us that aren't, maybe we think we're still quite young at this age, I include myself here. What do you think laptops, computers, cell phones are doing to our posture over time? We're going to be even more impacted. But we see this process where over time, as we age, often, we're going to see tight muscles. Maybe you already noticed that when you get out of bed in the morning. We're going to see decreased flexibility, especially in the hips, the knees, the ankles. We're going to see more abnormal curvature of the spine, increased thoracic kyphosis, right? Probably increased neck, the upper cervical spine, neck flexion, or hyperextension. We're going to see, unfortunately, more pain. And we might also see decreased mobility, strength, and endurance.
那其实高龄者在这个经年累月的这些使用习惯，刚才 Rachel 有示范啊，一些像肌肉紧绷啊、力量的减少啊，甚至疼痛的一些发生。那其实随着年纪，我们正常的一个脊椎的一个曲度的一些变化，其实都会在老化的过程中发生。
The most common postures we're going to see over time if someone is seated in a wheelchair. We're going to go through these next. So the first one, posterior pelvic tilt. Very common with our elderly clients, right? What is happening in posterior pelvic tilt? We always want to think about the pelvis. I call the pelvis the foundation. We also want to think about the spine. And we want to think about the head. So we know that when we get this posterior pelvic tilt, I'm very good at demonstrating this. What else happens? I'm going to have increased thoracic kyphosis, aren't I? And I probably am going to have, you can hear me breathing heavy now, I'm probably going to have increased neck flexion. And if I am able to, I might try to look up and get hyperextension of my upper cervical spine. This is our common posture in aged care. This or this.
这个就是我们常见，其实，在老人族群、年长者族群很常见到，就是这个骨盆后倾的一个姿势。那它其实并不只有骨盆发生后倾这件事，它连带还会带到我们的脊椎跟甚至我们颈椎的一个变化。那刚才 Rachel 有做示范，就是如果他有能力的话，他可能还会想要把头抬起来，那可能进一步造成我们颈部的一个过度伸直的一个动作。
Anterior pelvic tilt isn't quite as common, definitely not as common, but we can see it, especially in elderly women, if they have a lot of redundant tissue around their backside. They tend to sit with a little bit of an anterior pelvic tilt. In this case, when we look at the pelvis, right, our PSIS is higher than our ASIS. I'm going to have increased, I can't do this one very well, I'm going to have increased lordosis of my lumbar spine, right? And usually we see them looking up, hyperextension of the neck.
好，这个是骨盆前倾。那当然在年长者族群里面稍微比较没有这么常见。那它连带的会出现是我们的腰部的，就是lordosis， 我不知道怎么，对，就 lordosis 会增加，对。好
pelvic rotation, right? What happens in pelvic rotation? One side of the pelvis or one ASIS is going to be more forward than the other. What happens to the spine when I do that? Rotation of the thoracic spine in the same direction. And what happens to the neck? Sometimes people will try to turn their head to correct it. You might also see a lot of lateral flexion and even some neck flexion as well.
骨盆的旋转其实连带就是会带到躯干的旋转，然后我们人会自然的想看往前方嘛，所以也会去做我们颈部的一个就是转正的一个动作，那甚至会带有一些就是侧 lateral flexion 的动作出现。
Yeah, you can definitely do it in your seat if you want to. Pelvic obliquity. What happens with the pelvic obliquity? One ASIS is higher than the other. I have to hike my hip to fake it here. What happens then, right? If I've got one hip higher than the other, what starts to happen to my spine? I start to create a curve or a scoliosis. And to compensate, sometimes then I bring my upper thoracic spine back, and now I've got this S-shaped scoliosis.
所以骨盆的歪斜，主要就是会造成，也会连带着我们脊柱的一个歪斜，那可能会我们身体想要做一个代偿，甚至会出现一个 S 型的脊柱侧弯。
Windswept deformity. can be a little tricky. What came first, the pelvic rotation or the windswept deformity? Here, the main thing that's going to happen is you're going to have a pelvic rotation and or obliquity, and you're going to see the legs. One is going to abduct and externally rotate, and the other is going to abduct and internally rotate, which gives that sweeping look.
那这个风吹式变形其实蛮 tricky， 就是你也不知道它到底是脚先发生呢，还是骨盆先发生。但总之就是我们的双侧的下肢会做出一个反方向的一个变形的一个状况。
Now, what happens with these abnormal postures over time, right? It's not just that it's a bad posture and probably will lead to pain, but there can be a lot of other secondary complications. When I sat in that really bad posterior pelvic tilt, what happened to me, right? If I sit in this posterior pelvic tilt, can you already hear how my breath is shallow, isn't it? I can't get a deep breath in this position. What else am I going to have a hard time doing then? Swallowing, right? How about reaching? Am I going to do well at that? You need thoracic extension to reach all the way up, don't you? Not getting any there. Digestion is going to be impacted. My bladder is going to be impacted from me in that position. So getting the right posture for somebody and the right setup, the right wheelchair and seating can actually impact their overall medical well-being.
那不良坐姿其实不仅仅就是他做的不好而已，然后也不是说做的不舒服或是疼痛的问题而已，进一步导致就是像是刚才示范的一些功能性上的一个限制，以及它独立性上的一个限制，这些更多的一些健康隐患。
So where do we start? We start by remembering that our role as an occupational or physical therapist is going to be to try to optimize. Maybe we can't make it perfect, but to get the best posture and the best stability and alignment for that person to limit the negative effects.
那我们其实作为治疗师的角色，就是在于能够去协助个案做到最大程度的去改善他的摆位，然后以及坐姿的稳定性。那我们能够去限制这些异常姿势的负面影响。
And that is by having the total solution. So many times, people will tell me, well, I put a great cushion on this wheelchair. But if the wheelchair doesn't fit them, it doesn't matter how good that cushion was. Sometimes people will say, well, I got a great wheelchair, but I didn't get them a cushion at all. Or maybe I didn't give them the right back support. We have to have all three working together to give us the best outcome. We can't leave one out, and often we leave out the back support.
那这就是其实我们常常提到就是所谓的最佳的一个座椅系统，就是刚才提到 total solution 的部分。那摆位其实不仅仅就是一个单一的辅具可以解决，而是必须要3元素：坐垫、背靠跟轮椅的组合跟运用，才能够使这个我们的所谓的座椅系统发挥最好的一个功能。
So let's start off. We're going to go through each one of those: the wheelchair, the seating, okay, the cushion, and the back support. So let's start off by talking about the wheelchair. Now, we should be applying the same standard that we would if we were working with a young 25-year-old as if we were working with a 95-year-old. Okay? And we know there was a study that was done that said independence in mobility is a key factor in life satisfaction and contributes to maintaining the quality of life for elderly and the aging manual wheelchair user. And we also know that wheelchair setups demand knowledge of the client's history and potential for function, which means they need us to do an assessment to determine the right equipment. If it didn't matter, we wouldn't need a job. Right? You could just go to the closet and I could just say, here, Owen, here's your wheelchair. Have a nice day. Hope it fits. They need us at every single age to help determine the right equipment.
这边其实就在说，我们期待能够用相同的一个标准，不论你是在面对年轻的身心障碍者，还是在面对高龄族群，那我们的评估的标准都是一样。那它其实是需要我们专业人员的一个依照他们的病史跟去判断他们的潜能，然后去给出最合适的一个建议，然后是不论年纪的。
Whenever I start deciding, or I'm teaching a course on deciding what wheelchair to get someone, is it a manual wheelchair? Is it a power wheelchair? Is it a folding wheelchair with a power add-on to it? I always start off with the least costly solution. Right? Whether it's funding or the person's own money, we should always start off with the least costly solution. So I always start off to think about a manual wheelchair. And the question comes up, to propel or not to propel? We know that there's a high demand on a body for propulsion. It doesn't mean that because they're older, they can't do it. Many of them are more fit than younger people, but we have to consider some important points, like the shoulder. I used to think that I loved the shoulder until I heard Rainey give a talk in Hong Kong on the shoulder, and now I think that she should be the shoulder lover of the two of us. Shoulder abnormalities increase with age. Look at this percentage. If you're under 20, less than a 10% prevalence of a shoulder abnormality. If you're over 80, 62%. So if you are seeing someone that's over 65, make sure you're asking about their shoulders, right? Do they have pain? Can they move their arm? What do we need to be able to do to propel? We know there's a lot more risk also of rotator cuff tears, the severity of that tear, and how well that surgery will work.
那就是在任何的给予建议之前，其实我们都会从最经济的选项开始给予建议，当然就是会先从我们会先从手动轮椅去开始。那对于高龄族群来说的话，我们第一个要去想说，他能不能够推行这个轮椅，他需要推吗？那其实主要就是要去看所谓的肩关节的一个问题。那肩关节的一个病变或是疼痛等等，其实随着年纪增加的，所以我们是需要去思考他能不能够去做手动轮椅的推行。
It's not just the shoulder I need to think about if they're going to propel with their upper extremities. I also need to think about any other existing injuries. Like, What about wrist or elbow injuries? Right? Carpal tunnel syndrome is quite common. It doesn't mean they can't push a manual wheelchair, but it might mean that I do the setup differently. It might mean that I get a different type of hand rim for them to push that keeps their wrist in a more neutral position. I also need to think about their posture. When you have something like kyphosis, it's going to impact your ability to propel a manual wheelchair. I could probably spend an hour talking about why, but what happens when we're in a kyphotic posture? What happens to the humeral head of my shoulder? It moves forward, doesn't it? So every time I'm pushing that manual wheelchair, I'm just jamming, pushing that humeral head into the front of my shoulder capsule. Do you think over time that's going to cause pain? Probably, right? So I need to look at their posture and think about how it's going to impact their propulsion. I also need to consider what other demands they have. How are they getting in and out of the wheelchair? How are they doing their activities of daily living? How many times do they have to reach overhead during the day? And how much more impact am I asking them if I ask them to propel? It doesn't mean they can't do it, but it might mean that I help them in other ways, like getting them a grabber, right? A reacher to grab things, or trying to talk to them about their posture.
那关于这个上肢的运用的一个考量，我们其实除了肩部之外，也会去考量它的肘关节啊、腕关节是不是也有相对的一些问题存在？那它是不是需要自己去执行一些像转移位啊，或是有现存一些姿势上的问题？像刚才示范的驼背的这样子的一个kyphosis 的问题，其实也会影响到我们肩关节的一个运用。那其实不是说这样子就不能够去执行轮椅的推行，而是我们可以透过就是轮椅的配置，然后去让他们达到同样可以去做轮椅推行的一个目标。
Not everybody propels with their upper extremities, right? There's other ways that people are propelling their wheelchair, which we're going to talk about. Hemi-propulsion. Now, how many of you have tried to hemi-propel a wheelchair longer than this distance on a surface that isn't perfectly flat? Is it possible? I'm going to try to hemi-propel here. It's not going to go well. Now, what happens to me when I try to hemi-propel? What's my posture, right? I just keep sliding down. Also, I can only do it for so long because it's physically exhausting. Hemi-propulsion is very common after someone's had a stroke, right? After someone's had a stroke, they also have problems with endurance. And now we've given them a very difficult way to propel. Are they going to be functional in the community? Do you think they can propel long distances? No. So they have to rely on someone else to push them. I don't know about you, but if I had to rely on someone to push me all the time, I would get really annoyed. I probably wouldn't go many places, and I would become very isolated. Hemi-propulsion works on smooth surfaces, very limited to the home, not community, right? We also need to think about, if we are going to have them hemi-propel, how is their wheelchair set up? is it low enough to the ground that they can put their foot on the floor without having to go into this sliding posterior pelvic tilt? I know someone asked a question about that, so we're going to come back to that. But the answer is yes, we can lower some wheelchairs so that they can get their foot to the ground, pending their height.
单侧这个 hemipropulsion 其实主要就是发生在中风的患者。那其实我们平常看到都是在平地上，但我们并没有真的去在外面的环境中，不论是地面状况等等的，或是有斜坡等等，我们没有去思考过，就是这个在外面的环境可不可行？它还是比较是属于在室内使用的一个方式。那同时我们也要去考量中风病人也会有耐力的问题，那在比较长的一个行进距离下可不可行？那同时也要去考虑我们用脚去做推行啊，这其实是容易造成坐姿下滑或是骨盆后倾的一个状况。那从这里其实我们可以去思考轮椅的配置，我们给予的一个坐高足不足够低到让他们能够去执行这样子的一个推行。
Now, which one is harder, hemipropulsion or foot punting? Foot punting is when, I think this one's harder for me, when you have to try to pull with both your feet. Now, I'm doing a good job staying upright. This is what most of our clients look like, isn't it? Here they are. When I used to work in the aged care center, they would come to therapy like this. I'm ready. I'm like, no, you're not. What are we going to do with you in that posture? Foot punting, also very common. Literature suggests if you are using your feet, you should propel backwards to make it less energy. Now, I don't know about you, but most of my elderly clients can't turn their neck this far the whole time. So how safe is that? Right? Really, another big problem here is this seat to floor height, which we're going to talk about. We can still use it as an option, but we have to make sure we set them up correctly.
刚才示范就是用这种双脚蹬地的方式，用双脚去做轮椅的推行。那其实研究是指出，用倒退的方式是比较节省能量的。因为下肢的 extension 是相对比较容易的嘛，但是其实还要考量说你倒退着也会有安全性的问题，所以其实也不太可行，不太实际。所以呢，就是它是一个 option， 但是你也要去思考它能不能够透过我们，如果你真的要建议你的个案使用这样的方式，那我们要去思考轮椅的配置，一样是坐高的问题，它足不足够低到让我们可以去做这样子的一个推行，又同时不会有造成姿势的一个问题。
Wheelchair configuration matters at any age. When we're talking about wheelchair configuration for older aging adults, it is still important that we talk about their center of gravity. Okay? We define that in a wheelchair as where we put that big rear wheel. Seat to floor height. Seat width, seat depth, right? And in some cases, frame depth, and the rolling resistance. We're not going to talk about that too much today. And we know that for efficient propulsion, it's very important on where our weight is distributed in that wheelchair.
那其实基于个人推行的方式，我们在配置上都会有所不同。不过基本上其实就脱离不了就是这个 COG 重心的设定、坐高、坐宽等、坐深等。那有效率的一个推行跟我们体重在轮椅上的一个配置会息息相关。
Center of gravity. For some reason, as people get older, we're very afraid that they're going to break more easily. Or even after someone's had an accident, like a spinal cord injury. And so what we like to do is we like to take this rear wheel and move it way far back so that the chair is really stable, right? I've been guilty of this when I first started. But when we do that, we take away their function. If the wheel is way back, if I sit up forward, and my wheel's all the way back here, how much of the wheel can I grab to push? Versus, if the wheel is in line with my arm, the center of the wheel, how much more of this wheelchair, how much more of this wheel can I get? Which means each push is more efficient. For someone that's older, this is really important. If they have to use a lot of energy to push, don't we want to give them the most efficient push possible? Don't be afraid to move the center of gravity. The way we can give them stability is by making sure we set up their posture correctly, making sure if they're new especially, they don't have good wheelchair skills, we put anti-tips on the back, right? And we can help with the depth from the front sometimes if we get them a more customized manual wheelchair. And the final thing I used to tell my elderly clients or anyone was, you're gonna have to learn to have it this way. It's better for you, and you'll get used to it. Right? Especially if it's one of their first chairs.
其实这个主要就是在讲那个后轮重心的一个位置的调整。那其实面对年长的用户，我们其实更习惯于倾向将这个重心放得非常后面，但是这其实对于我们手能够接触到轮子之间的一个相对关系会影响的非常大。如果你真的很担心它会跌倒或是后倾的话，就记得加上防倾杆就可以去改善这个问题。但是我们还是希望能够把这个 COG 往前移，这样子的话能够增加推行的一个效率。其实对于年长本身就有这个耐力跟力量的一个问题的话呢，其实是能够在 COG 这个部分得到一个改善。
Seat to floor height, if they're hemi-propelling or they're punting bilateral lower extremity, you need to make sure you get a manual wheelchair that can either adjust or already has the right seat to floor height. Right meaning when they are sitting in their chair, if they're doing those, if they're doing upper extremity, it's not a problem. They need to be able to have their foot flat on the floor, not with their back this far from the back support, right? And their pelvis in a neutral or as neutral as they can get position. This chair is too high for me, right? To reach the ground, what am I going to have to do? I'm going to have to slide into posterior pelvic tilt. So it's very important, if they're foot propelling, using their foot on the ground at all, that we get that right seat to floor height. So you can ask the question, does this wheelchair have an adjustable seat to floor height? If not, maybe I need to consider a different one, or maybe they need to propel a different way, which is much harder to have that happen. Also, if they're foot propelling, especially bilateral, we often will cut the seat depth slightly so that they can bend their knee more to get a bigger pull. Check to make sure they can flex their knee far enough before you cut their seat depth. But if they can get a nice knee flexion, I make it a little bit less so that they're not bumping the cushion or the seat sling when they're propelling.
这个slides 其实刚好也是有人在就是先前提到的 Q&A 里面有问到，就是关于用脚来做推行这个动作，我们怎么去做轮椅的 set up。那其实坐高还是要取决于说我们希不希望，我们要让个案的这个双脚是能够完全平贴地板上的一个状态去做一个设置，所以基本上一定要降低坐高，所以确保你的轮椅是在一开始它就是你就是给予它一个这样子的一个高度的一个轮椅，或是说它是坐高可以调整的一个轮椅。那如果说我们 就是确保他的膝关节弯曲的角度足够的状况下呢，我们也会考虑是不是稍微减少他的一个坐伸，来保证他的双膝是能够有足够的一个弯曲的空间。
Now, this is my big pet peeve, which luckily I don't have a chair that's too wide for me here, maybe good or bad. But when people have a chair that's too wide, I used to always have women say to me, now I'll need room on the side of me for my purse to go. And I would look at them and say, absolutely not. Because, right, happens, doesn't it? Or they want to put their water bottle on the side, or I have no idea, other things. No, we'll put those somewhere else safe, because if I give you all this extra space, what are you going to do? You're going to lean, oh, hi, and you're going to have this horrible obliquity that's going to happen. Right? Too wide is much more common than too narrow. Don't go too wide so they can put their possessions in their chair with them. Let's find a different place to put the possessions. And let's make sure that we think, people say to me, well, what if they grow a lot? You have to gain a lot of weight to gain that much width. Okay? You can ask me. When we gain weight everywhere, don't we? I don't think this is such a problem in Taiwan, but I come from the US, which is the #1 country for obesity, and now I live in Australia, which is the #3 country for obesity. So this is a very common question in these countries, and I say, I think you have to gain I had a client that did gain enough that he needed a wider chair, but it was like 20 kilos before, okay? If you think they're going to fluctuate weight, maybe here, it's more common if they're on insulin, or not insulin. There's other medications, that's not going to come to my head, that can cause them to gain weight, like bloat, retain water. Ask if the wheelchair has any spacing. Some wheelchairs, you can space them out a little bit, space the wheels, and move them to gain some width if you need to. But we don't want extra space for stuff. We also want to make sure we don't go too narrow, because if we go too narrow, especially back supports, be very careful if they have curves to them, that you're not getting too narrow or the person doesn't like it, and then they turn to make themselves more comfortable. Okay?
那其实大部分状况下，我们看到的轮椅都是刚才示范，就是轮椅都是过宽的一个情形。那他们可能在这个过宽，他们会说他们想要放什么东西在轮椅上，但其实这个都不是我们建议的一个状况，找其他地方去放这些东西就好了。然后我们那个轮椅如果过宽一个状况下，会让你的骨盆很容易出现一些歪斜的动作，所以它就没有办法达到很好的一个摆位的一个效果。那再来就是说，如果他真的长胖到一定的程度，就是轮椅的坐宽，因为长胖觉得不够的话，可以去询问他的辅具的厂商，他其实还是会有一些可能透过轮子这个部分去做调整，可以做到坐宽的一个微调。
We know if we get the right fit, we can get the person to be more independent and more function.
好，所以其实有正确的轮椅配置，其实我们可以清楚看到一些功能上的一些进步。
We can also think outside of the box. Again, let's not be ageist. Just because they're older doesn't mean that we shouldn't consider power assist or power add-on options, right? They can help make the wheelchair more efficient. There's lots of different kinds, some in the wheels, some with joysticks, some with little dials now. That can help. We also don't just have to put it on for someone that propels with their upper extremities. Somehow that kind of became a thing where it's only for people that propel with upper extremities. The better group to get it for is somebody that hemi-propels, right? or somebody that bilateral lower extremity propels. That's the group I'm always thinking, can I get some power onto this wheelchair so they can go into the community or not be so tired going just down the, hall. A lot of them can have programming so we can turn down the speed. I would start with that if they're new to it. Turn down the speed a lot. And we can keep in mind that some can be really easy to transport, right? Some are heavy, maybe it's more difficult, but some can be quite small and lightweight now. So it's important we take that into consideration.
那就是前面一开始讲的就是不要就是做年龄歧视者，就是不管是年轻的使用者还是年老的使用者，我们其实都可以去思考电动助力设备的一个可行性。那其实如果说一开始没有那么有信心的话，其实也可以透过 programming 去使电动设备的速度降低。那其实就是在说年纪不是限制他们能不能够使用 Power Assist 的一个限制。那现在其实 Power Assist 也有非常多的一个种类啊，或是款式啊、重量可以做选择。
And here's just an example of Alvin, who's 90 years old, who has an above knee amputation on his right side. He couldn't get a power wheelchair because he couldn't transport it. So instead, he uses a power assist, and all he has to do is steer with his foot. So it pushes him forward, and he steers. Much less energy, right?
所以他这个就是他，因为他没有办法使用电动轮椅，他没有办法运输它，所以呢，其实后面是给予一个 Power Assist 这样子的一个设备。那他的脚其实主要就是做一个导向的一个动作，他就不需要去做任何的推行，反而是用脚在做一个方向的一个控制。
And when should we consider powered mobility, a full power wheelchair, right? Maybe the person really is not going to be functional at propelling their manual wheelchair. Okay? Maybe they need power seat functions for their health and well-being. Maybe they have positioning needs that we can't meet with a manual wheelchair. Maybe we need some tilt or things for them. Maybe they need a joystick to be able to move around, or another input device, like a chin control. And maybe they have a diagnosis where it's progressive. So it's going to continue to get worse over time. Maybe it's something like Parkinson's. And so maybe we can set them up in a power wheelchair that keeps them going longer.
那当这个 Power Assist 没有办法解决他们问题，我们其实可以考虑是否使用电动轮椅。那电动轮椅，或是说它可能会有更多摆位上的需求，电动座椅功能的需求，或是它是一个进行性的一个疾病，其实我们就可以考虑使用电动轮椅的这个选项。
I tell people when they say, how do we know if someone can functionally propel a manual wheelchair? Very simple. Can they propel their wheelchair, in whatever way they do, in a safe, timely, and efficient manner? If the answer is no to one of those, then I consider them not functional. And I need to think about a power add-on or a power wheelchair. So safe, timely, and efficiently, for whatever distance their goal is.
那我们还要去想，有些人他是可以推行轮椅，但不到所谓的功能性推行。那其实这时候就可以考虑使用电动移行的一个设备。那就是也要去考虑说，它虽然能够推行，它能不能够在一定的时间之内，像是这样子的一个考量。
There's my favorite ICF model again. when we think about this ICF model, we can fill out each section to let us know about, what we think might be some limitations like shoulder weakness or things they want to do like social gatherings. Maybe they have uneven terrain or long distances. Maybe they need to be independent. And when I fill this out, it can help me to determine if manual, power add-on, or power wheelchair is right for them.
ICF model 就是在这边作为一个运用，其实就是你能够去列出各种以个人为中心的一个考量之后，再以这个 ICF model 去给予一个建议。
And there's different types of power wheelchairs, right? Some are like scooters, some they come with just standard seating, and some have really advanced seating. So you have to decide based on that ICF model, what you need that wheelchair to be able to do to pick the right option.
那在适合建议使用电动轮椅的一个情境，这边有列出，就是你可以也是透过一样刚才讲的 ICF model， 然后你去判断说它是不是更适合使用电动轮椅。
And remember to ask questions. Lots of power wheelchairs have some programs, or even power add-ons have some programmability. So things like turning down speeds. Maybe you can make some shortcuts where they could use like a button to do a feature. Maybe you need specific power seat functions. Like maybe you need them to be able to lift their legs up and down. Maybe it can be manual or power. So make sure you write the list of what you need, so then you can find the right option that works.
然后同时就是电动轮椅的话，也要去考量，就是考虑哪一些电动座椅功能其实对个案是有注意的，然后能够透过就是 programming 或是电动轮椅的一些调整，或是电动轮椅的一些配置，来达到你的一些就是对于个案设立的一些目标。
One of the main reasons that I moved to a power wheelchair for elderly clients, actually two. One is the shoulder. So remember, I love it so much. And the other one is because of the risk of pressure injuries. If they cannot change their position in a manual wheelchair, if they cannot stand up or lean to relieve their pressure, we need to consider a power wheelchair so that they can tilt and change their position to protect their skin. So I'll start here at the bottom just to show you. In aging, we change from 15% risk incidence of a pressure injury 1 year post SCI to 30% at 20 years. And we know that people over 80 years old were 4 to 20 times more likely to develop a pressure injury than those 65 to 70. So as you get older, right, it keeps going up drastically, their risk. So we need to make sure, how can they relieve their pressure? They cannot sit in that chair for 6 hours a day without relieving their pressure. And they may not feel the pressure like all of you do right now in this seat. Right? Less nerve endings, okay? Less sensitivity. So we need to make sure that we consider that, and if we're going to get them a power wheelchair, especially with multiple power seat functions, we need to make sure that we're helping them to understand how to use it. Right? They can't just tilt a little bit. They need to go all the way back. And you can check. You don't have to have a pressure map. You can also just check and see. If you can slide your hand in between their ITs and the cushion, there's no pressure, right? That's my pressure map.
好，这边在说什么样的族群我们会建议他就是从手动我们会 转而建议电动，除了刚才讲到的肩关节问题之外，另外一个就是所谓的压伤的一个风险。那其实压伤的风险随着年纪也是会不断的增加，所以我们在建议用电动轮椅的其中一个很重要目标，也是在于就是电动轮椅的一个电动座椅功能能够协助减压的这个部分。
Now we're going to move on to cushions, but we're first going to help you guys relieve your pressure. So can we take maybe 10 minutes? Okay, come back in 10 minutes at 15:20, and we'll start again on cushions. Thank you.
好，谢谢。那我们现在就是休息10分钟，我们要准时在20分的时候回来。